Every year, thousands of older adults wake up thinking it will be a normal day, and within minutes their lives change forever. A stroke can happen suddenly, quietly, and without warning. One moment someone is speaking clearly, walking normally, enjoying breakfast, and the next moment words become difficult, the arm feels weak, or the face begins to droop. What many people don't realize is that a stroke often gives small warning signs long before it strikes. The good news is that many strokes can be prevented, and recognizing the early symptoms can save a life, protect the brain, and preserve independence. In this video, we are going to talk honestly and simply about stroke, how it happens, how to prevent it, how to recognize the warning signs quickly, and what to do immediately if it occurs. A stroke happens when blood flow to part of the brain is suddenly interrupted. The brain needs oxygen every second to function properly. When blood cannot reach a part of the brain cells begin to die within minutes. This is why stroke is considered a medical emergency. The longer the brain is without oxygen, the more damage can occur. For older adults, the risk of stroke becomes higher because the body changes with age. Blood vessels may become narrower or weaker, and certain health conditions become more common. However, understanding stroke can give people the power to reduce their risk and protect their health. There are two main types of stroke. The first and most common type is called an ischemic stroke. This happens when a blood clot blocks a blood vessel that supplies the brain. Think of it like a pipe that suddenly becomes clogged, preventing water from flowing through. When the blood cannot move freely, the brain tissue beyond that blockage begins to suffer from lack of oxygen. The second type is called a hemorrhagic stroke. This happens when a blood vessel in the brain bursts or leaks, causing bleeding inside the brain. The pressure from the bleeding damages surrounding brain cells. Both types are serious, but understanding what causes them can help people reduce their chances of experiencing one. One of the biggest risk factors for stroke is high blood pressure. Many seniors live with high blood pressure without realizing how dangerous it can be. When blood pressure stays high for a long time, it weakens blood vessels and makes them more likely to clog or rupture. Doctors often call high blood pressure the silent threat because it may not cause noticeable symptoms, yet it quietly damages the body over time. Monitoring blood pressure regularly and following medical advice can significantly reduce stroke risk. Another major risk factor is diabetes. When blood sugar levels remain too high for long periods, it damages blood vessels and nerves throughout the body, including those in the brain. Diabetes can also increase the chances of blood clots forming, which can lead to an ischemic stroke. Many people think diabetes only affects sugar levels, but it actually impacts the entire circulatory system. Managing blood sugar through medication, healthy eating, and physical activity plays a very important role in stroke prevention. Heart disease is also strongly connected to stroke. The heart and brain work closely together through the body's circulation. When the heart rhythm becomes irregular or the heart struggles to pump blood effectively, clots may form and travel to the brain. One common condition called atrial fibrillation causes the heart to beat irregularly, which increases the risk of stroke significantly. Regular medical checkups help detect these issues early so they can be treated before complications occur. Lifestyle choices also play a powerful role in stroke risk. Smoking, for example, damages blood vessels, thickens the blood, and reduces oxygen supply. Over time, smoking increases the chances of both types of stroke. Alcohol consumption in excessive amounts can raise blood pressure and weaken blood vessels as well. Even lack of movement can contribute to stroke risk because physical inactivity leads to weight gain, poor circulation, and increased blood pressure. The encouraging news is that small lifestyle changes can greatly improve health and reduce stroke risk. Nutrition also has a strong impact on the health of the brain and blood vessels. Diets high in salt, unhealthy fats, and processed foods can contribute to high blood pressure, high cholesterol, and obesity. These conditions make strokes more likely. On the other hand, foods rich in vegetables, fruits, whole grains, lean proteins, and healthy fats help protect the heart and brain. Many seniors find that simple dietary adjustments, such as reducing salt intake, eating more fresh foods, and drinking enough water, can make a noticeable difference in how they feel. Exercise does not have to be intense to be beneficial. Even gentle daily movement supports circulation and brain health. Walking, stretching, light gardening, or simple home exercises can strengthen the heart and improve blood flow. For many seniors, consistency matters more than intensity. A short walk every day can improve blood pressure, support weight control, and help maintain strong blood vessels. Physical activity also benefits the brain by improving mood, memory, and overall well-being. Understanding the warning signs of stroke is one of the most important things every person should know. Stroke symptoms often appear suddenly, and acting quickly can save brain cells and improve recovery chances. One of the easiest ways to remember stroke symptoms is through the word FAST. The letter F stands for face drooping. If one side of the face looks uneven or a smile appears crooked, it could be a warning sign. The letter A stands for arm weakness. If a person cannot raise one arm or one arm drifts downward, this may indicate a stroke. The letter S stands for speech difficulty. Slurred speech, confusion, or difficulty forming words are serious warning signs. The letter T stands for time. If any of these signs appear, it is critical to seek medical help immediately. Some strokes also present with other symptoms, such as sudden severe headache, dizziness, trouble seeing in one or both eyes, confusion, or difficulty walking. These symptoms may feel frightening or confusing, but recognizing them quickly can make a life-saving difference. Many people delay seeking help because they hope the symptoms will disappear. But every minute matters when the brain is deprived of oxygen. When a stroke occurs, quick medical treatment can limit damage to the brain. Hospitals have treatments that can dissolve blood clots or control bleeding, but these treatments work best when given early. This is why recognizing symptoms and acting quickly is so important. Calling emergency services immediately gives medical teams the opportunity to respond fast and begin treatment as soon as possible. Recovery after a stroke varies from person to person. Some people recover quickly, while others may need longer rehabilitation. Therapy may include physical therapy to improve movement, speech therapy to restore communication, and occupational therapy to help with daily activities. The brain has an amazing ability to adapt and recover, especially when rehabilitation begins early and patients stay committed to the process. Family support also plays a powerful role during stroke recovery. Encouragement, patience, and understanding help stroke survivors regain confidence and independence. Many seniors feel frustrated during recovery, but steady support and small progress over time can lead to meaningful improvements. Maintaining hope and focusing on gradual progress often helps individuals stay motivated during rehabilitation. Preventing a stroke often begins with regular health checkups. Doctors can identify risk factors early and provide guidance on managing them. Monitoring blood pressure, cholesterol levels, blood sugar, and heart health gives valuable information about stroke risk. Many conditions can be managed effectively with medication, lifestyle changes, and proper care. Stress management is another factor many people overlook. Long-term stress can raise blood pressure and negatively affect the heart and blood vessels. Relaxation techniques such as deep breathing, spending time outdoors, prayer, meditation, or connecting with loved ones can support emotional and physical health. Maintaining social connections and staying mentally active also benefits brain health. Sleep also plays an important role in overall well-being. Poor sleep or untreated sleep disorders can increase the risk of high blood pressure, heart problems, and stroke. Seniors who maintain a consistent sleep routine often experience better energy, clearer thinking, and improved health. Creating a calm bedtime environment and avoiding heavy meals late at night can support better rest. Another important factor in stroke prevention is staying informed. Knowledge allows people to make better decisions about their health. Understanding medications, following medical advice, and asking questions during healthcare visits empowers individuals to take control of their well-being. Many stroke survivors later say they wish they had known earlier how preventable many strokes actually are. Community awareness also saves lives. When more people understand stroke symptoms and risk factors, they are more likely to respond quickly if someone needs help. Teaching family members and friends about stroke recognition creates a safety network that protects everyone. Sometimes it is not the person experiencing the stroke who notices the symptoms, but someone nearby who recognizes something is wrong. Healthy aging does not mean avoiding every health challenge, but it does mean making choices that support long-term well-being. Many seniors continue to live active, fulfilling lives by staying informed, maintaining healthy habits, and listening to their bodies. Stroke prevention is not about fear. It is about awareness, preparation, and taking steps that protect the brain and heart. Even small daily habits can build strong protection over time. Drinking enough water, choosing balanced meals, moving regularly, managing stress, and following medical advice may seem simple, but together they create powerful protection. The body responds positively to consistent care, and the brain benefits from good circulation and oxygen supply. For many families, stroke becomes a wake-up call that encourages healthier living. Conversations about health, lifestyle, and prevention become more meaningful when people understand what is truly at stake. Taking care of the body today can protect independence, mobility, and quality of life tomorrow. If there is one message to remember from this video, it is this: stroke can happen suddenly, but knowledge and quick action can save lives. Recognizing symptoms early, seeking immediate medical help, and making healthy lifestyle choices can dramatically reduce the risk and impact of stroke. Awareness is one of the most powerful tools we have when it comes to protecting our health. Many seniors watching this video may be thinking about their own health or the well-being of someone they love. That awareness is important. Paying attention to the body, attending medical appointments, and making small improvements in daily habits can protect the brain and heart for many years to come. Your health matters. Your life experience matters. And protecting your well-being allows you to continue sharing wisdom, love, and memories with the people who care about you. Stroke prevention is not just about avoiding illness. It is about preserving the life you have built and continuing to live it fully.